We are bringing you here today with Pause, Reflect, and Heal with Dr. Randy. This is the show that celebrates the ever-important human-animal bond, and we welcome any questions, comments you might have. You can reach us at www.drrandypetvet.com. There's a phone number that you can leave a voicemail. I can't always answer all of the veterinary questions that come up, but I'd be more than happy to bring them to the show, and we will discuss them, and we've been doing that all through these podcasts. I want to remind our listeners that in the past, we've had some great visitors to the show. We had Dr. Brian Cabin, an MD who is also an integrative veterinarian, integrative doctor. We've had Paul Blauschild, a world-famous dog trainer. We've had Christine Delmonico, who is basically from Pet Joke, the supplement Joke. We've had Brandon Bush on from Animal Biome and discussed about microbiome and the importance of that. I want to let everybody know that if I look a little different to you today, that's because I had major eye surgery last week. Still recovering, but I decided you guys can handle it. I can handle it. We're going to do this show. But I want to say so thank you so much to my good friend and Dr. Leslie Neems at Tucson Eye Care, who performed the surgery. She's an amazing MD, an amazing ophthalmologist, amazing plastic surgeon, helped with some lid problems that I was having, blocking my vision. So I apologize for my looks today, but we'll muddle through the show so we can get through this. Remember that Pause, Reflect, and Heal celebrates pet wellness and longevity. I will help your pets live healthier, happier lives, so you can too. And that's the important thing, that this show feeds off of both our pets, our dogs and cats, and also our pet parents, who are all of you listening. So welcome to the show. Today I'm going to do a little something different. We have talked a lot about a lot of different subjects, but I'm actually going to do a show about me and some of the experiences that I have, some of the really fun things that have happened to me through my education, my internship, my shadowing over at Animal Medical Center in New York City. These are kind of fun stories, and I thought that I would relay them to you and share them because you wouldn't believe some of the things that have gone on, and I want to make sure that you get a chance to know who I am and kind of the things that I've done in the past. So bear with me on these stories. I'll try to get them to you, and you can comment on them again. Remember, you can always reach us at drrandypetvet.com. Love to hear from you. Love to know how you're liking the show, what you're enjoying, what you're missing, what you'd like to see in future episodes. So reach out. Love to hear from you. So I want to talk a little bit about getting into veterinary school first. So in the late 70s, there were only 23 veterinary schools in the United States. At that time, there were over 150 medical schools in the United States. So veterinary school was a much more difficult process and a much more difficult acceptance rate than the medical schools. And so most of those vet schools were looking for obviously excellent students that had grade point averages of 3.8 and over, also had side experiences where they had worked at other veterinary practices, they had volunteered at shelters, and this was something that was very common. The interesting thing about the University of Pennsylvania, where I went to vet school, was they were really looking for a diverse population of students. So they weren't just looking for the science-based student, they were also looking for art history majors and religion majors, people who also wanted to get into the veterinary program but may have had a little different background than some of us. So at that point, when I made my first application, I had a 3.8 average from college, George Washington University, and I was one of 4,000 applicants for 107 positions. So if you do the math, you realize that that's a very difficult percentage to deal with. At that point, they were really accepting, the most common situation was people who have applied up to 3 times and sometimes even more. So I made application, did not get in the first time around, did not get in the second time around, and was really kind of losing faith. But I got a really great research job at the University of Pennsylvania Medical School, and I met a woman by the name of Dr. Maria Delavoria Papadopoulos, who was head of pediatric respiratory medicine at the University of Pennsylvania, also at Children's Hospital in Philadelphia. And she was a guiding light who said, Randy, you just have to hang in there. Everything that you've done is phenomenal. You've got the personality for it. You're going to be a blessing to veterinary medicine. And I did hang in there and ended up on my third application getting accepted to the University of Pennsylvania. This was in 1976. At that point, I walked into my first class at the University of Pennsylvania. And if many of you do or don't know, there's this syndrome called the imposter syndrome, where you've done all the things that you need to do to get to where you want to be. You get there, and then all of a sudden you're wondering, is this something that I really can do? Or did I just pull this off and I'm really not sure that I'm going to be able to do this? And so I walked into class thinking, here I am applying 3 times. I didn't know what the average of my class was. I looked around, there were 106 other students. And then I found out after the first day that the majority of my class had applied 5 times. Many of them had PhDs. I had part of a master's degree and I applied 3 times. So that imposter syndrome slowly started to fade away. The good news about the veterinary program and vet school was at the end of the 4 years, I was president of my class. I had gotten the highest honor in the University of Pennsylvania Vet School called the Leonard Pearson Prize for clinical acumen and dealing with all of my studies. And so obviously, the comment that I'm going to make to you all is don't give up on your hopes. If it's something you want to do, stick after it. Do everything you can to make it happen, because it has been a godsend for me. 43 years of being a veterinarian has told me that it was the right choice from the very beginning, and I'm so glad that a woman by the name of Dr. Maria Delavoria Papadopoulos encouraged me to continue going on and do what I did, and then graduating with all of these honors of my class. So, and I'm not saying that to brag, I'm just telling you that don't give up on your goals. Make sure that you keep fighting for what you want. So that's the story about veterinary school application. The second story, there's a couple stories that go along with what we call an internship. So at the veterinary programs in the United States, some of them, I guess many of them, offer what's called an internship. An internship is an extra year of study, usually rotating through medicine and surgery, and you stay at the university that you get into as for this internship. And there were internships in the United States. There were also foreign internships that you could get. So I applied for a number of them, but I got accepted into the University of Pennsylvania Small Animal Hospital. I also got accepted into the University of Pennsylvania Large Animal Hospital. Now, many of my friends and some of you won't know this, but my goal when I went to veterinary school was actually to be an equine surgeon. And an equine surgeon means that you go to an internship, you do 2 or 3 years of a residency, you sit for your surgical boards, and then you practice somewhere, usually at a university, but now there are a lot of established veterinary large animal hospitals that would take veterinary surgeons. This was what I wanted to do. I found out all through my veterinary program that I was leaning both ways. I could have gone into the small animal hospital, I could have gone into the large animal hospital. The reason why I did not end up taking the large animal internship was my experience was I was at a place called New Bolton Center, which was the large animal facility for the University of Pennsylvania. Very prestigious. Many, many racehorses go through there. It's a fine facility. They do great work. But I found that a lot of times the horses that came in there were worth more to the owners for insurance purposes than they were to be alive. And I realized that that wasn't what I wanted to go into veterinary medicine about. And again, it's not a comment on the whole horse industry, but it was what I witnessed when I was at the University of Pennsylvania. So at the very last minute, and I mean the day before the decision had to be made, I selected to take the internship in small animal medicine and surgery at the University of Pennsylvania. Again, another godsend because it was incredible experience. The University of Pennsylvania at that time were looking for residents. And these are the people who teach the interns, who also go on to get board certified, whether it's in internal medicine, surgery, neurology, cardiology. But they were looking for resident applicants who had been in practice for a number of years and wanted to come back and now specialize. So it was a great group of people that I got to learn from, because not only was I learning from the best in the veterinary world as far as education, but I was also learning from the best of people who had been out in private practice. So for example, when I did my orthopedic rotation, we'd have a dog with a fracture that would come in, and the orthopedic resident would say, now, Randy, I want you to tell me how to fix this for no money or for unlimited amount budget, all the different ways that we could fix this fracture and make this work. And this is the way that I was able to learn a lot of practical information going through this rotating medicine and surgery internship. So I'd like to tell you a couple stories about my internship, because it was really fascinating. So to digress a little bit, the intern, the person who takes the internship from University of Pennsylvania and then goes into the medicine and surgery rotating internship is usually the first person to be on what's called TES, which is the Trauma Emergency Service. So TES, or Trauma Emergency Service in Philadelphia, is a place where they will see up to 60,000 cases a year going through the hospital. Many of them come in through emergency. So the intern and the residents get to learn a tremendous amount, because I'm a visual learner. I can read about diabetes, let's say, for example, 10 times. But if I see a case and get to deal with it and get to practice on healing that case, I will learn about diabetes. So this was fabulous, because I got to see a little bit of everything. So the story I wanted to share with you is my first story about my internship, and that was being on call. The intern from the University of Pennsylvania would be the first person to do the night shift. So that was 8 p.m. to 8 a.m., many times 8 p.m. to whenever you got out. Could have been 10 o'clock, noon, who knows. But that was the shift that you basically were involved in. And so the interesting thing about that shift was, in my first 10 days of being there, I got to see every night what's called a gastric torsion in an animal. Now, gastric torsion, for those of you who don't know what that means that the dog has eaten, usually it's kibble, has drank a lot of water, maybe gone out and run around, and the kibble starts to ferment and cause gas production in the stomach. And by doing this, it will cause the stomach, many times in a very deep-chested dog, like a Great Dane, let's say, or a Doberman, or a Golden Retriever, for the stomach to actually twist on itself. And that's called gastric torsion or volvulus. That is a life-threatening emergency. So when those things, when that happens to a dog, it has to be seen very quickly, because once the stomach has twisted, now imagine a piece of a Tootsie Roll that has twists on both ends. When you twist both ends of the stomach, you cut off the blood supply to the stomach, and it starts to what we call necrose, or break down. So that animal has to be seen very quickly. So the first gastric torsion came in. I had to call the surgical resident in, and that dog was operated on. I got to be involved in that operation because the rest of the night was kind of slow. The next night, another gastric torsion. Different dog, called the surgeon in, got to help with repair, got to see how that dog recovered. Both dogs did beautifully. Third night, another gastric torsion. So at this point, the surgical resident, who was Michael, his name was Michael Aronson, no relationship to me, said, Randy, you've already seen 2 of these. You have the surgical people there. You do the surgery and correct this. So that was great, and I was really excited about it. What I didn't tell him, or what I didn't really know to start with, was this was a Great Dane that presented to TES, or the emergency service, after being stung by bees. So this dog not only had a gastric torsion, but it had a face that was 3 times the size, all swollen. It was reacting in what we call anaphylactic shock. So we had to place a catheter. start high doses of antihistamines and steroids to stabilize the dog, just to get it upstairs to the surgery suite. So we do this, the dog stabilizes, blood pressure looks great, color looks great, temperatures now come back to normal, and we prep it for surgery. So a little backstory about surgery is the surgery suites in the veterinary hospitals are basically closed rooms because you don't want outside air to get in there. You have what's called laminar airflow. So that gets the bacteria out of the room and not in your surgical suite. But there are no windows. Well, there are windows, but there are none that open, let's say, and a door in and out, but that's pretty much it. So we get this Great Dane upstairs, we put it on its back, start prepping it for surgery. We see this gigantic big abdomen. We actually, what we did was called trocaring the abdomen. So we actually stuck a needle in the abdomen to release some of that gas. So there wouldn't be so much pressure for this dog and it would be a lot more comfortable. Get it on the surgical table, start working on basically prepping it and opening it up for the surgery, at which time I get in there, make the initial incision, see the stomach. It's very, very black, and but it's kind of quivering and moving in a weird way. And so I wasn't quite sure what was going on, but I made my initial incision into the stomach, and at that time, hundreds of bees flew out of the dog's stomach. So the dog not only got stung by bees, but ate part of the hive and had all of these hundreds of bees in its stomach, which I am now releasing into this closed room that basically are flying around. And I wasn't really sure what the complications were going to be with this. I have to tell you that the surgery went great. The dog lived. The dog did really, really beautifully. But I will tell you that everybody that came into surgery the next day was cursing me because we still had hundreds of bees in this closed space that were a potential problem, not only for everybody getting stung, but the animals getting stung. And so this was a story that went on for quite a long time, that I released this beehive into surgery while saving this dog's life and fixing a gastric torsion. So that's the gastric torsion beehive story. The second story I'm going to tell you about my internship was also very fascinating. We get this phone call about the second week that I'm involved from somebody saying this little dog had collapsed. It was potentially a heart problem, and it was not doing well, and they were bringing it right in. What they failed to tell us about them bringing it in was that they were, the person who owned this was one of the Philadelphia mob bosses, a very, very nice Italian fellow. And when the dog came in, it came in with him and 3 bodyguards to be worked on. And so the dog presents, we take a good look at it, we realize that it is having some really bad ventricular tachycardia, and then, which is a very unusual beat of the heart, not efficient to keep the blood flowing going. And then we basically get it on, its side, hook up the EKG machine, where at that time we were using alcohol on the leads so that the EKG machine would read this dog's heart rate and we could watch it. At that time, the resident came in, who was a radiology resident. She wasn't an internist, but looked at the dog and said, oh, we're going to have to use the paddles to resuscitate this dog, which means defibrillator. Any of you that know about these defibrillators know that these paddles send out quite a shock into the body to shock the heart back into a normal rhythm. What she didn't realize was that alcohol was being used, and she never asked, on the EKG leads. So I want you to picture this. There's 3 of us, meaning myself, 2 students, the medical resident, the radiology resident, and the mob boss and 2 of his bodyguards standing around this dog. So we ended up, basically, she called for these paddles and she didn't check on the leads as far as the alcohol. And what happened was, when she pressed the paddle to shock the animal, it set off a spark. And that spark basically hit the alcohol. And all of a sudden we were seeing this very light blue flame and some smoke coming off of the dog's coat. It sounds terrible. Thank God the dog was fine. But I look over, and the mob boss now has fallen to the ground, passed out. He fainted. The two, guards are basically working on him. We're working on the dog. We quickly got the flame extinguished. The dog did fine. It only burned a little bit of its coat. But I just want to tell you that I thought my life was coming to a quick end looking at what had happened through all of this. The dog ended up being great, went to cardiology the next day. They basically had it on medication. It lived another 3 years very successfully. And I got a very nice thank you from him, thanking me for saving the dog. But the resident got chided by all of the upper professors for using paddles in the face of alcohol. So that's my dog EKG defibrillator fire story, and that was another thing in my internship. The next story I'm going to tell you is a story that basically happened to me when I went to the Animal Medical Center in New York City. The Animal Medical Center is a 8-story building. It has over 50 veterinarians. It's the largest small animal hospital in the world. I went there because they were doing laparoscopy, which is looking inside the abdomen for a certain type of problem that they were trying to research in the liver called Wilson's disease or copper storage disease. We were doing midline laparoscopies at Penn, myself and an internist there, Dr. Chiapella. And the person in New York was doing flank laparoscopies, and they were having some issues with samples they were getting. So they wanted me to come up and show them the midline laparoscopy, which I did, and I got to spend some time. And they said, why don't you stay and shadow for a while, and you can stay as long as you'd like. And so I did. I shadowed the internal medicine department and had some amazing experiences. So I want to tell you the first day that I started shadowing the internal medicine department. I'm with the intern, I'm with the residents. This lady comes in with a red pixie hat on, green velvet pants, and gold pixie boots, okay? If you can picture this, she looked like a leprechaun, basically, holding a white sack with this big something inside the sack. So basically, I'm sent in to get the history. So I start talking to this woman. I said, tell me a little bit about what we're seeing you for today. And she said, well, my tiger python that's in this bag hasn't eaten in 3 months. And I'm thinking to myself, I don't know anything about tiger pythons. And I didn't know that 3 months is a long time. Usually a month, but anything longer than that's not normal. So she said, I'm really concerned about it because I have others in my apartment in New York City, but this one's not well. Can you take a look at it? And so, of course, I called the intern and the resident, and we examined this snake. Oh, and I have to tell you, this is a 50-foot snake. It is as big as large as my arms are, so you can tell how thick it was. And we could tell by pinching its skin and whatnot that it was dehydrated. So we decided to take this to radiology to see if we could x-ray the esophagus and the stomach. Now, I want you to understand that in a 50-foot snake, this could be 5 or 6 feet into the snake where we're even looking. We got to x-ray the snake. The way we did that was we sedated it, gave it some intramuscular ketamine and also some Valium, and sedated it, placed it in a large PVC pipe so that it would hold still, so we would be able to x-ray through the pipe but into the snake. And we saw that in its stomach, there was a foreign body sitting there, basically obstructing this snake's GI tract. So we then went with the snake to do endoscopy, which I do, and that is looking inside the abdomen, looking inside the stomach, looking inside other areas with a fiber optic tool to visualize. So fortunately, it was long enough to look into the stomach, and we found a blue object down in there, which we started to pull out, and we were able to remove. And what this was a surgical drape. And this lady's boyfriend worked at one of the surgical centers in New York City, apparently had towels lying around, a drape lying around, and the snake, for whatever reason, ate this thing. And we were able to save the snake's life, to pull it out. So when the snake was recovering, I went out to talk to the woman, and I said, just out of curiosity, what size place do you live in New York City? And she said, oh, I have a one-room apartment, and I have 10 of these snakes in that apartment. And I just shuddered to think what that environment looked like. But that's New York City. You probably could see more exotic wild animals coming in the Animal Medical Center from New York City than sometimes even you'd see in a zoo. So that was my snake surgical drape story. The snake again went on to live and do very, very well. So I wanted to share that with you. And that kind of finished up my internship, my time shadowing at Animal Medical Center, at which time I moved to Tucson and started in veterinary medicine in Arizona. So I'm going to fast forward a little bit and tell you a little bit about how I became an integrative veterinarian. So I had some amazing skills coming from my internship at the University of Pennsylvania, coming from the Animal Medical Center. It was very, very good training, and I was really able to do a lot of things in my practice in Tucson that people couldn't normally do because they didn't have the experience or the knowledge. And that included, we were doing things like doing back surgery, fixing fractures. At this time, there really weren't any specialists. So there weren't any in practice, that's for sure, in Tucson or in Phoenix. So a lot of this fell on whoever could kind of do this or figure this out. And practice was going extremely well. I worked at a veterinary practice in Tucson. I felt like I was not getting to my full abilities. Accepted a job in Phoenix for a couple years. Also found that at that time that practice was kind of promised to me as a partnership. And at the end of 2 years, all I got was a contract basically saying it was a non-compete form. So I decided it was time to open my own practice. And I looked at places that seemed to be undercovered as far as veterinary care in Arizona. The two places that really popped up were Sedona and Green Valley, Arizona. I picked Green Valley, Arizona because it was a lot less seasonal at that time than Sedona. And it was a great population of retirees who were really caring about their animals but didn't have the quality of care that they could get. And so I opened my practice in Green Valley, Arizona. I worked for about 10 years in that practice, expanding 3 times from 3,600 square feet to 10,000 square feet. But I also found in that practice that I was putting out a lot of fires. You've heard me talk about this in other podcasts, but I felt like I was great at helping animals, but I was never really achieving wellness. So I'm looking at this point of how do I get to add more things to my practice than I'm already taught. I couldn't really add a lot more Western-wise because I had great Western background, but I could look at some of the complementary therapies like Chinese herbology, acupuncture, rehabilitation therapy. So I decided, after reading a little bit about Dr. Andrew Weil, also an MD, integrative MD from Philadelphia, I'm from Philadelphia, that there was a possibility that I might be able to add herbs to my practice and help with some of the longevity and wellness cases that I thought that I wasn't really getting to. Made a decision to go to Albuquerque, New Mexico. At that time, there was something called the Southwest Institute. It was a human institute. They accepted me as a veterinarian, and I came there to learn about Chinese herbs. Well, the rude awakening was I get there only to find out that I could learn about Chinese herbs, but I couldn't add them to my practice because I needed to learn traditional Chinese medicine, because these herbs are all based, like acupuncture, on what's called traditional Chinese medicine. That means learning a different paradigm than the Western medicine that I already had studied. Chinese medicine looks at the entire body, does what's called pulse and tongue diagnosis, which I had to learn, and then able to incorporate all of these Chinese herbs into my practice. This was a year of study, only to go on to the International Veterinary Acupuncture Society and study veterinary acupuncture to add to my practice, which are the first 2 things that I started working with in my integrative mode. Since then, as you've heard me talk, I've added rehabilitation certification, done extensive reading and research on nutrition and supplements and things like biohacks that we can use for our animals to really improve their wellness and longevity. But I wanted to let you know that's kind of how the integrative medicine story started. The next step in my pathway was I was finding that I was doing really well adding these things, and I was getting great at wellness and longevity, but I saw a lot of post-operative cases, meaning orthopedic post-operative cases, older animals, older dogs and cats that have osteoarthritis that I didn't really feel my Western medicine was helping. So I went and got certified in what's called rehabilitation medicine through the Canine Rehabilitation Institute. At that time, it was in Melrose, Florida. A woman by the name of Dr. Jan Van Dyke started it. Amazing woman, great friend of mine to this day. And I got to study for a year on rehabilitation medicine and all of the things I could do to help not only my post-operative orthopedic and neurologic cases, but also all of the animals that basically I could help who are senior dogs and cats that really needed more without using more and more strenuous medicines, more and more dangerous type NSAIDs and pain medication. And the rehabilitation has been a godsend. We at Paws Veterinary Center in Tucson, Arizona, have one underwater treadmill. We're adding a second one. We use pulsed electric magnetic therapy. We use cold laser. We use therapeutic ultrasound. We use a lot of floor exercises. I have a wonderful certified technician with me, Diana Pacheco, who basically does all of the rehab work for me when I bring the cases in. And together, we have done really, really good job with the help now of Jordan. We're really working on these cases and getting great results without going to stronger and stronger medicines that actually potentially harm the kidney and liver. But we have some great advent of things that we can do that have really made my practice incredibly successful. So I'm going to talk a little bit about some cases. Let me take a sip of coffee here. Okay, so the first thing I want to talk about is chronic kidney disease in cats and dogs. When I was in veterinary school, and really even to this day, the most common thought about chronic kidney disease is kidney disease, the way you assess it is by what's called nitrogen breakdown products. These are things like you may have heard of creatinine or BUN. Now there's an enzyme called SDMA, which shows us early kidney disease. But these are ways to assess these cases. And what happens is nitrogen breakdown comes from protein. So the thought was if we limit the amount of protein to these animals, then their body isn't going to be stressed as much, and they will be able to handle their disease, basically trying to thrive in that environment. The fallacy with that is, and what we found out, and this was something that my urologist that I learned from, nephrologist at university, Dr. Ken Beauvais, said, you know, if we limit the protein, what happens in kidney disease for all of us is our kidney doesn't hold the protein in our body. So you see abnormally high levels of protein in the urine. As creatinine and BUN, these enzymes go up. So if you limit the amount of protein in these animals, guess what happens? The numbers look good for 6 months, 8 months, a year, but they have to get protein from somewhere because they're now eating low protein diets, mostly prescription diets, and they're losing all this protein through their urine. So what happens is they start stealing protein from their muscles, and even though they look better, they start getting thinner and thinner until eventually they will waste away because they can't sustain that environment with that low protein. So I basically was out there looking for a way that we could feed our dogs and cats high quality protein and still not deal with the high nitrogen breakdown products. I discovered a product called Azadil, which is a probiotic that binds nitrogen in the body. And so we can feed our animals these high quality protein diets and bind nitrogen with what's called Azadil. And I started doing that, also using a phosphate binder called epacatin. Now there's another one called Nariguin, which we use. And that's because there's a lot of phosphate in these meats and whatnot that they're eating, bones and whatnot that get ground up in those high protein diets. And I found that these, especially kidney cats, would live so many more years in this environment of high quality protein, but binding the nitrogen, binding the phosphate, and they just did better and better all the time. I also added another product that increases what's called the GFR, which is the blood flow to the kidney, and that really has made a big difference. It's called Aminovast, and I use that also. And those three products have really created a situation in my cats and a lot of my dogs that to do incredibly well for years and years, not lose muscle mass, thrive, and continue to do well. So I just got asked by the Japanese Veterinary Medical Association. I spoke to about 2,000 of them by internet and a webinar talking about this whole procedure of what we've been doing. And I'm thrilled that I continue using it and do well. Now, I will tell you, there are some cases where there's enough kidney damage, this will not work. But in most situations, it will really make a huge difference in the quality of the animal's life. They're eating high protein, really high quality diets, and they're not wasting away to nothing. So that's my basic first talk about cases and some of the things that I do. I also wanted to talk about ozone therapy. So if you look up ozone on the internet, you'll see the FDA labels ozone gas as a toxic gas. Ozone is only toxic if you breathe it directly. When you use it in other forms, whether it's diffused in oil, basically underneath the skin, basically given as a rectal enema. Also, it can be used to ozonate blood, and that blood is then passed through a UVI filter given back to the body called major or minor autotherapy. There's a very famous MD in Las Vegas, Dr. Frank Schallenberg, who is really the father of ozone therapy. And he often, if you would go up there, most people are cancer patients, you'd get into an ozone sauna where your head out of the sauna so you're not breathing the gas. You'd get blood ozone. You'd also get rectal ozone done. And he's had an incredible effectiveness of treating cancer. Why is that? Because cancers don't like oxygen. And the more oxygen that are around that cancer, the more the cells will die and stop proliferating. So we use ozone at Paws Veterinary Center for a lot of our cancer cases. Whether it's in blood form or rectal or subcutaneous, sometimes we can even what's called limb bag, where we put a bag around the area of the tumor and just infiltrate ozone gas. None of this is being breathed by any of us or the animal, so it's very, very safe. We've been very, very fortunate to partner with my good friends at O3 Vets, and have done a great job using a lot of their equipment to continue treating, and we continue doing ozone therapy to this day very successfully. Another thing that I wanted to talk about is what's called pulsed electric magnetic therapy. You'll see it listed as PEMF. I got started with it being PST Global. I heard about this MD years ago. His name was Dr. Markel. He was a German physicist and an MD who came to Johns Hopkins to research magnets and the effectiveness of magnetic therapy on the body's disease process. So he was there for a number of years, being both a physicist and an MD, and in that time got 12 patents to use PEMF or PST, which was what his company was called, on all types of cases to treat pain, to treat arthritis, to treat areas where we want more blood flow and lymphatic flow. And so I got the chance to talk to him multiple times. Now in Europe, you could go into any PEMF or PST clinic and get this done, and it's often done a couple times a week, and people swear by the effects of what it has done for their arthritis or other ailments that they've had. The FDA has blocked a lot of the PEMF therapy in the United States for people. Fortunately, in veterinary medicine, we're governed by the USDA and the FDA, so we have a little bit more leadway, and I've employed Dr. Markel's therapy. We have 3 PST machines that can travel to people's homes. We often do that in acute back problems, other acute orthopedic problems. Also to get bones to heal faster. We'll put that machine and utilize it and have our clients use it. We also have a couple very larger units that we use at Paws. And we also now use what's called an Assisi mat, which is PEMF in a mat form. And our animals often, when they come in for rehab, will lay on that for a little while before they start their therapy. This, again, increases blood flow, decreases inflammation, helps bring lymphatics and healing into these areas. We think even stem cells. So PEMF is a great therapy. If you're interested, you can look up PST Global, which is Dr. Markle's company. Unfortunately, Dr. Markle passed away a few years ago, but he was a great pioneer and a good friend to me and really helped me learn about magnetic therapy for our pets. Again, another therapy that we can use in the integrative world, integrative practice. The last thing that I want to talk about is the adding of a couple of things in my practice that I've talked about in separate seminars, and that is trying to help our severe allergy dogs, our severe GI or gastrointestinal dogs, our cancer animals, and some of the other situations with skin disease and whatnot by utilizing some testing that allows me to do something completely different than a lot of veterinarians are doing right now. For example, in a severe allergy dog, most of these cases come to me, they're second and third opinions. They've already been on what's called an elimination diet or elimination diets to no avail. They've been on Apoquel or Atopica, two immune suppressive type drugs to help decrease the allergy, which do have limited effectiveness, but they don't work forever and they're not a complete cure. So it does help, but it isn't really where they want to be. So most of the time they come and they're asking me for a second and third opinion on how to approach this. And I needed to have some scientific basis for how I was going to work on these GI or gastrointestinal or allergy dogs or cancer animals. And so the first thing that I added to my practice was something called NutriScan testing. This testing was developed by Dr. Jean Dodds, a professor of mine at University of Pennsylvania. Jean ran the largest blood lab in the United States in California. She's brilliant. I call her the grandmother of veterinary medicine. She's done all this research in thyroid disease, but she definitely discovered that you could use saliva testing and basically DNA to diagnose allergy sensitivities, food sensitivities. Okay, this is not an inhalant test. A lot of the blood allergy tests are very expensive. They also have a lot of false positives and negatives. This food sensitivity test called NutriScan, NutriScan, is something that you can get yourself online. You can do that swab testing and find out what is my dog allergic to, or what do I have to avoid in the situation to really help get this allergy thing started to be under control. The second piece of information that I use on these cases is called animal biome. Now, biome is the trillions of good and bad bacteria and yeast and fungi that live in our bowel that control a lot of things. And we are finding on a day-to-day basis more and more information on how important this biome is. Animal Biome Company started in California. They were working with the University of California Davis Veterinary School. They're now a private company, but they do amazing research on the DNA of the bacteria, yeast, and fungus that are in our dog and cat's bowel that are either good, bad, or are missing. And by having that piece, and then we can use their supplements, basically using what's called fecal microbiome transfer, FMT, to basically improve all of the good and bad bacteria in the bowel and get these animals to start healing, coupled with the NutriScan test. Then I have two pieces of science that I can really work with to really start healing my animals. I do use a lot of supplements with this. Make sure they're always on a great source of omega-3 fatty acid. I also add methylcobalamin or B12. I'm also a big fan of Ion Gut Health for pets. This was formulated by a human naturopath, Zach Bush. Great product. I take it every day, the human product. And also will often add colostrum to that routine. And this is the way that I've worked on my allergy cases. And generally within 6 months to a year, these animals are great. Now, I tell you 6 months to a year because most people want instantaneous gratitude. It takes time for the body to change over and heal itself. But now we are giving it the tools that it needs so that it, one, isn't sensitive to some food that it's supposed to be not eating, and two, we're balancing the biome or all of the flora in the gut, in the GI tract, to make this really, really healthy. We're using Ion Gut Health to close the tight junctions in the bowel to prevent what's called leaky gut syndrome. So I wanted to tell you about that because this is a great advent to my practice, and many of my second and third opinions, whether they're in Tucson or by telemedicine, basically have done incredibly well. For telemedicine cases, if you're interested, you can reach me through Paws Veterinary Center, and that's in Tucson, Arizona. It's www.pawstucson.com, or their phone number is 520-888-7297, and I will do telemedicine consult for an hour with whoever sets these things up when they're interested, and it's gone incredibly well. So I want to let you know again that most of our podcasts are brought by Paws Veterinary Center. Paws Veterinary Center is an integrative veterinary practice that I started with my wife 15 years ago. We do all of the best of Western medicine and add all of the complementary medicine, many of the things that I talked about today. Again, it's www.pawstucson.com. Paws does it in a very different way. We are a very high quality, low volume practice. Our staff is incredibly well trained, and we really focus on healing your best friend. That's our motto. That's what we really shoot for, and it's really, really great to be associated with them. And for that, I'm going to basically stop for today. That was this episode of Pause, Reflect, and Heal by Dr. Randy. Hope you enjoyed all of these humorous anecdotes. I've been told many, many times I need to write a book. When I find the right ghostwriter, I probably will. But for now, doing these podcasts is my way of getting that information, some of those fun stories out to you. And again, if you want to reach me, www.drrandypetvet.com, and you can go on my website. My podcasts are listed on there. I have a lot of articles pertaining to many of the things I talked about today. Thanks for being with me today. Definitely get back to me. Let me know how you enjoyed the stories, how you enjoyed this podcast, and we'll come back to you in a couple weeks with a new podcast. Thank you.